this. Method number one, it is method by Burdenko. Russian famous surgeon Burdenko. In this method, we use external layer of dura mater to make the plastical reconstruction of the sinus wall. Who can give me one paper? Thank you. No, it's enough. And please give me also your pen. Now I will show for you, it is very simple method. By the way, I performed this method in the Russia. And I will show it now for you. Technically, it is very simple. For example, this is our sinus. And this is defect on the sinus wall. Let's cut this, not so beautiful, sorry, and remove. Now what I am doing, from neighboring place, be careful, I form the flap from external layer of the dura mater. Size of the flap approximately twice bigger than the size of the defect, which I have on the sinus wall. And again, I disconnected it from the mother tissue. Now you can see that base of this flap look to the size of the side of defect. What I do after, I turn it into the defect, and I apply usually interrupted suture. By the way, what is important, I must apply this suture and in the level of the base. Here we don't have sinus. Here we have just two layers of the dura. It will stand here only one layer, no any problem. We can live without even this layer, Anyhow, I will close the defect. Why this method is great? Because I use the same material to close the defect, and it will give great regeneration, dura to dura. Unfortunately, this method have one problem, guys. Right, please. We cannot close the defects, which is bigger than 3 centimeter in diameter. Cannot. Because you cannot find so huge piece of the dura, to make the flap, which will be enough, for example, to close 5 centimeter defect. 3 centimeter, it is maximal size, which we can close by Burdenko. Remember about it. Second method of plastical reconstruction, also not bad. We can take the flap from Galea panevrotica. Galea panevrotica histologically, it is same connective tissue as the dura, but it is twice thicker. Galea is thicker than the wall of the dura. That's how you form the flap from Galea panevrotica. You take it, you put it in the defect, and you suture it. It is firm structure, so it will. And method number 3, it is using of the cadavers, conservative dura mater. Cadavers, conservative dura mater. Usually in neurosurgical hospitals, we have specially conservative cadavers, and it is impregnated by metals. That's why it doesn't give autoimmunity reaction. Usually, any organical tissues, foreign tissues inside of the human body gives the transplantational immunity. T lymphocytes, which we call killers, come and start to kill these tissues. Self-immunity. That's why we use the special preparing of this dura mater by metallical impregnation to prevent any immunity. That's like immunity system think that this is non-organical material and doesn't give any immunity reaction. Works only, transplantational immunity works only into organical tissues. Into non-organical tissues, it doesn't work. That's why we can use the titanium, for example, to close the defects of the skull, and it doesn't give any immunity reaction. And this is understandable. Of course, we must use non-organical material which is inert, doesn't give chemical reactions. chemical reaction, immunity reaction. It is absolutely different. Do you understand this? Very well. That's why remember, please, big defects we can close by to another method. Right, please. If plastical reconstruction is impossible, we can all even ligate the sinus from two sides and close it forever. But we can ligate only superior sagittal sinus. Write it, please. In front of sulcus centralis. Closing of all another sinuses or superior sagittal in another place can give the mortal complication because of increasing of intracranial pressure. Let's say 1 minute look here, please. 80% of all your sinus traumas will be superior sagittal sinus. Why? Because it is most superficial. Yes. From this 80%, 50% will be in front of your sulcus centralis. Approximately place of location of your sulcus centralis, it is brachial. Yeah. Midpoint of your coronal suture. How we projected sulcus centralis by method of the Ronley. I showed in previous class, yeah? Middle meningeal artery, sulcus centralis, sulcus lateralis with road. Yes. That's how you can easily find the place of its projection. Let's say, remember, please, only this sinus we can ligate. Right, please. Technique of ligation of the sinus. We use cutting, now not piercing, but cutting long needle. Length of your needle should be at least 2.5 to 3 centimeters. Cutting long agrammatical needle with non-absorbable monofilament material. Right, please. Needle inserted into dura mater approximately half of centimeter below the sinus wall. Half of centimeter below the sinus wall. And piercing distance from two sides will be approximately 1 centimeter. From downwards, we take it, half of centimeter, 1 centimeter. From two sides, approximately 1 centimeter. Why, friends? Why so big piercing distance? Because you must apply big force to close this sinus valve, because it is not the soft wall of vessel, it is dura. Yes. That's why if your piercing distance will be small, ligature will cut the wall of the sinus. That's why this is important to take big piercing distance to prevent the damage of the sinus wall. By the way, I forget to tell you about ligation of the veins. Here everything is simple, and ligation of the sinuses. Just by one ligature in each side. And it is closed firmly. Here we don't have big pressure inside of the vessels. Let's say two ligatures. One in proximal side, one in distal side. For the veins, everything is simple. You apply just one ligature in each side.
The strongest one?
Of course. Of course. Idea is understandable. Yes. Right, please. There are also one method of arresting of bleeding from sinuses. It is temporal method. And we call it the tamponade of the sinus. Look on the picture, please. That is the method of the tamponade of the sinus. Right, please. This method is used mainly for superior sagittal sinus. Also can be used for transverse sinus, because this is the most superficial sinuses of the human body. Technique of the tamponade. Long tampons, it means sterile bandages, long tampons. The length of it will be approximately 10 meters. Inserted from two sides of skull wound. inside of epidural space, inserted from two sides of skull wound, inside of epidural space. 1 minute in the picture. This is one side of your wound. This is another side of your wound. You can see that in both sides we inserted very long bandages. Approximately each one will have the length 10 centimeters. You can say me why so big. Again, friend, show Hamza. Now look everybody here. Hamza right hand, it is bone. Hamza's left hand, it is superior wall of the sinus. Hamza's exercise book, it is inferior wall of sinus. I take the long tampon, this is second margin of the bone, and I insert it in two sides, inside of epidural space. This is epidural space. Why I must to have so big tampons? I must to make here the big volume to press this wall to down. You understand me? If I will insert a big piece of this bandage inside of epidural space, finally big volume will be formed here. Upper wall will be pressed to the lower wall. Sinus will be closed from both sides. Thank you very much. Now remember what I tell you. Remember, this method used to temporarily arrest the bleeding before you will reach the hospital. But in some critical conditions, it can be used like permanent method of arrest the bleeding only for superior sagittal sinus in front of sulcus centralis. Because as I say you, we can close only superior sagittal sinus in front of sulcus centralis. In that case, of course, you must use antibiotic therapy to prevent infection, and you can remove the tampons not early than 10 days after insertion. 10 days they should be inside of the head. Why it is necessary? Only guys after 10 days, if you will remove this tampon, tromp will not be removed together with tampon. Before it, between tromp and tampon, there are connections. During the 10 days, they disconnect it because by mucus cover this tampon, and you remove it without the removing of the tromp from inside of the vessel. So remember, please, it can be used like permanent method of arresting the bleeding also. Idea is understandable for you? Cool, very well. Let's continue, guys. Now write, please, arresting of the bleeding from brain tissue. From brain vessels and nerves. Guys, everything is absolutely simple to soft tissues. One big difference. It's forbidden to use any electrocoagulation. Electricity doesn't use in the brain tissue. Remember forever. Because it will destroy the electrical activity of the brain. That's all other methods is safe. Ligation, suturing, hemostatical sponge, because it is the same soft tissue as the nerves. That's all methods is absolutely safe. If it is understandable for you, write please second topic. It is skull wounds, classification and treatment. Friends, again I tell you, why I start to speak about skull wounds after arresting of the bleeding? Because any surgical treatment started from arresting of bleeding. So I must arrest the bleeding, I must clean the wound from blood, and only after this I can do another manipulations. Right, please. Skull wounds divided into two main types. Type number one we call non-penetrating skull wounds. Open the brackets and write, please. Dura mater is not damaged. Even bones can be broken, but if dura mater is not damaged, we call it non-penetrating skull wounds. And group number two, it is penetrating skull wounds if dura mater is damaged. Now write, please. First group, non-penetrated skull wounds. Again, divided into two subgroups. Subgroup number one, it is the trauma of soft tissues only. Subgroup number two, trauma of soft tissues and bones together. Is it understandable? Right, please. Penetrating wounds divided into open and closed. Open penetrating wound, it is the wound with damaged skin and soft tissues. Closed penetrating wound, it is the wound without damage of the skin. How is possible to imagine? I told you before, if internal compact layer will be broken without the damage of the skin, fragments of this internal compact layer can perforate the dura mater. So we will have perforation of dura mater, but it will be not open, it will be closed. Do you understand me or not? Let's say right, please. Number one, trauma of soft tissues. Method of the treatment. Point one, as we say, arresting of bleeding. I will not repeat it now how we do it, I did it before. Point number two, primary surgical treatment of skull wound. What it included? Point A, cleaning and if it is necessary, washing of the wound using antiseptics. Cleaning, washing the wound using antiseptic, removing all foreign bodies and necrotizated tissues from inside of the wound, removing all foreign bodies and necrotizated tissues from inside of the wound. Number three, very important point, guys, refreshing of wound margins in the brackets, right, please, if this margins is crushed and non-alive. Right, please, in the head region, size of refreshing approximately 0.5 centimeters. Into 0.5 centimeters, you can cut the tissues, half of centimeter, and remove from all the wound. Number four, drainage of all connective tissue spaces, which is involved inside of the trauma. Number five, suturing of the wounds layer by layer up to the drainages, which is inserted into spaces. That's how you can see, guys, that I don't bluntly close the wound. I leave the drainages. That's why 1 minute, remember please, listen, there are only one case. Then the wound can be completely closed without the drainaging. It is sterile wounds. Usually this is the operating wound. In case of operating wound, you don't need any drainage because you make it in sterile condition. No any microorganism doesn't reach the wound. All another possible wounds, guys, doesn't matter it is the knife wound, gun wound, bite wound, I don't know, which can imagine, crush wound, it is possibly infected. I'm not sure is it infected or not, but anyhow I drainage the species to prevent formation of the pus spread inside. Idea is understandable for you. As I said, this is the main points of the treatment of the soft tissue bones. Now right please, trauma of the bones. Trauma of the bones can be classified into the several types. First one we call the bone cracks or hairline fractures. What does it mean, the bone cracks or hairline fracture? Open brackets right, please. This is the type of the fracture which has the form of the line without dislocation of the margin of the fracture. Open the brackets and write, please, in real case, this dislocation should be minimal, not more than half of centimeter. What does it mean? You see the bone, look. And you see, for example, by X-ray that there are line-shaped fractures. You don't see dislocation of the fragments. They located in the same level. This kind of the fractures we call hairline fracture. Type number 1. Right, please. Type number 2 of the fractures we call external compact layer fractures only. Fractures of external compact layer. Hurry up, guys, time is very short. Open the brackets and write, please. Usually, it is happened because of the traumatization by sharp bodies, for example, knives. What does it mean, guys? After the knife trauma, usually sharp tip, perforated external compact layer. In majority of cases, force is not enough to perforate all the layers. Let's say external compact layer stop it, and let's say we have trauma of external compact layer only. You must understand that this is usually sharp traumas. Because if it will be blunt traumas, much more usual internal layer will be damaged, not external. Let's say right, please, type number 3. It is fracture of internal compact layer only. Most usual form, yeah, which I said before, because it is lamina vitrea, glass-shaped layer, which can be simply damaged. Usually it is because of blunt traumatization with big force. And finally, fourth, last type of the fractures we call complete fractures, or depressed fractures. This term is also used. Then whole 3 layers is damaged, and usually in the place of fracture, as in head of this person. This is real fracture picture, and you can see depression. Let's say bone is broken and it is pressed into inside. It means all layers of the bone is damaged and fractured. Let's say, remember, please, once again, there are 4 main types. Line shape, external compact, internal compact. Now treatment. Right, please. Fracture number 1. Line shape from fractures or the cracks. No necessity of surgical treatment. It doesn't mean that no necessity of treatment at all, but surgical treatment we don't use. Right, please. Treatment only therapeutical. Medicines which is decrease intracranial pressure, and which is make the higher the regeneration score of the bone. For example, D vitamin, calcium, which is make the high rate of the regeneration of the bones. Yeah. Of course, if it is necessary, you can use the analgesics if there are pain. If there are the edema, you can use diuretics. Let's say all the treatment is only pharmacological. We don't use surgical treatment, only therapeutical treatment. Right, please. Number 2, defect of external compact layer. Surgical treatment, it is primary treatment of the wound. Because here we have the wound of soft tissues, I say it is usually sharp, and we must do rest and bleeding, come from soft tissues and from the bones. Right, please, no any plastical reconstruction is not prepared. We just only arrest the bleeding using the same wax, sterile wax, which I say you. We arrest the bleeding. That's why we make treatment of wound only, not treatment of the fracture. Situation number 3, fracture of internal compact layer. Here we must to make resectional trephination. Resectional trephination. What does it mean? Right, please, along all damaged internal compact layer, which is identified by X-ray, along the all size of damaged internal compact layer, which we identify by X-ray. Look out for the X-ray show phase of the damaged internal compact layer. We must to make resection of external and diploitic layers. We must to make resection of external and diploitic layers. Technique of surgery, it is simple. In midpoint of this place, we make the drilling, and then using Dahlgren forceps, we enlarge aperture up to reach the margins of the damaged internal compact layer, which is identified again by X-ray. Idea is understanding. They say you made one aperture, and using the bone forceps, you enlarge this aperture up to the sizes of the removed bone. Right, please, after this revision of the cranial cavity, removing of all fragments and the resting of all bleedings. Consequence is same. Again, I start from bleeding, then I start to treat the wound. About defect, which has happened here. Right, please, for the adults, usually we close this defect using plastical reconstructional methods after 6 months. You can ask me why. Because during 6 months, you can see complications. For example, if you will forget some piece of the bone inside of cranial cavity, it will be inflamed. It will be that time to clean, wash, and remove. If I will close it immediately, after I must to break the material anytime. You understand me or not? For the children, defects is closed usually after 12. Again, situation is simple and understandable. Before 12, size of the head will be increased and size of defect also. If you will close it, big chance that the material will be sinking down. Today we have some transplanted material which can be enlarged by the age, but it is not so much elastic, it is special material with molecular memory. Molecular memory. This is the special kind of the alloys. They can be expanded. But unfortunately, in majority of the hospitals, you will not find such kind of material. There's a child must to have external protection, like the helmets, before you will apply this surgery. Idea is understanding of it. Right, please. In case of depressed fractures, fourth variant, there are 2 rules. Rule number 1, fragments which is more than 1 centimeter and which is covered by periosteum should be put it in their places and fixed by metallical constructions. Unfortunately, fragments which is less than 1 centimeter and doesn't have coverage by the periosteum should be removed because they will be necrotized. And again, treatment is same to the previous about defects. Treatment is same to the previous in the case of the defects. Again, if the defect of adults, we close it after 6 months. If it is the children, we close it after 12. Let's continue, guys. This is about the wounds. Very quickly, I try to give it for you. Now, right, please, next surgery group, it is trephinetions. Trephinetions. Right, please, this is the Latin term, and it means the opening of the skull cavity. You want to read my lecture? You say, guys, lesson is not finished. What are you doing here? Okay? Right, please. Trephination in the Latin, it means the opening of the cranial cavity. Trephination. Opening of the cranial cavity. The oldest surgery, and we find the several thousand year skulls with the apertures on the skull bones. Of course, majority of these surgeries provided not for treatment, but they have some sacral meaning. To remove some evils, for example, or something like this. But anyhow, this is very old operation. Nowadays, right, please, we have two types of trephidations. First one we call craniotomy, or in another case we call it osteoplastic trephination. Second one we call cranioectomic, or otherwise we call it decompressive trephination. Cranioectomic, or otherwise we call it decompressive trephination. Unfortunately, my time comes to conclusion. After 4 or 5 minutes I will finish. That's I study all the material I write here. Let's say, what is the difference between them? Let's say, and we will finish. Then we say craniotomy. Tomy, it is cutting. It means, 1 minute, look here please. I must to make the surgery, open the skull cavity, and then I should replace all the tissues in its place. But after my surgery, patient will not have any defect. Vice versa, then I say cranioectomy. Ectomy means removing of forever of the bone. After my surgery, the patient must to have defect of the skull. You can say me why. Everything is simple. Craniotomy provided radical treatment. You make it to remove some pathological problem from cranial cavity. For example, tumors, hematomas, pus, abscess. You need radical treatment. Let's say minute attention. Craniotomical trephination, it is only excess. After you must to make some special techniques. Cranioectomy or decompressive trephination, it is the whole operation. It's not only excess. After performation of this aperture, you don't do anything else. You suture soft tissues. That's why this is palliative treatment. If craniotomy, it is radical treatment. You remove the problem. Here it is palliative treatment. For what you do it? To decrease the pressure inside of the cranial cavity. Decompressive or cranioectomic trephination have only one meaning: to decrease the pressure inside of the cranial cavity.
Long life.
To make more comfortable or without pain. Today, Hamza, for medicine is not so much important the continuation of life, much more important quality of the life. Yeah, we think that it's much more better to live, for example, I don't know, some years comfortably than twice longer, but without discomfort. That is important. 1 minute, I will check your attendance.